slows down or speeds up the reabsorption of bone mineral. Prevents bone from being reabsorbed. It's too early in the morning for an old guy to be up here talking. The second thing I want to talk about is what nitrates do for things like pain. Every one of you, I'm sure, has access to or has a television set. And almost every day, I am bombarded with a pharmaceutical company's product to help with painful diabetic neuropathy. Okay? Nitrates turn out to be one non-pharmacological way to prevent the pain of neuropathy. That research is from just 2 or 3 years ago. So, if we consume nitrates, a lot of good things happen. Bone health improves, and pain tends to disappear. Why does that happen? As Dr. Haley just told you, nitrates and nitric oxide improve blood flow. When you speed up blood flow, more red blood cells carrying oxygen go down to tissues. Put a rubber band around your finger when you go home tomorrow. Leave it on for as long as you can. It will begin to hurt. That finger will become painful. How do you reduce that pain? Remove the rubber band. What happens? Blood flow returns to your finger and the pain disappears because you brought back more oxygen. Pain is reduced when the blood carries more oxygen to tissues. The next thing is important as well. The question is, are topical nitrates, those that we put on our skin, safe and effective for upper extremity tendinopathies? What does that big word mean? That's pain in a tendon, rotator cuff, epicondylitis we call. So people who are putting topical nitrates on painful tendons, Achilles tendons, or other tendons as well, see an improvement in the pain and improved flexibility. So we're not only talking about healthy, beautiful skin, we're talking about getting you back to a situation where you can function in life, where you can play golf, or go play soccer with your kids, or drive a car. Okay? Why does that happen? Research 2007 showed, again by surgeons, saying that nitric oxide improves tendon healing, wherever that tendon is. Rotator cuff, elbows, hips, Achilles tendons. Nitric oxide is good stuff. Eat your vegetables. Take our triangle of health. Tendons are made up of collagen fibers. Nitric oxide enhances collagen synthesis in tendon cells. Is nitric oxide good? Is nitric oxide good? The next thing I want to touch on is wound healing. This is just one paper. Again, I'm trying to bring you 8 or 9 years worth of research. But topically applied nitrates, not taken internally, improve the effect of certain things that help to heal ulcers. This study in 2001 talked about a painful ulcer that occurs in your rectum or anal area. Question is why? Again, surgeons, 1996, recognized that nitric oxide regulates the rate and speed and quality of wound healing.
I love science!
What did I say? I'll give you $20, you said? Okay? So nitric oxide is important for wound healing. Not us saying this, not the scientific advisory board, scientists. But we, that Mr. Hansen has gathered together, we on the scientific advisory board, chase every piece of scientific evidence that we can find to help build your practice to a point where you can answer questions that people ask about things like that. Let me give you another example of what good nitrates will do. Some of you have heard about or have elderly relatives that have heart disease. There's a situation where the heart becomes painful. It's called angina, pain in the heart. Why? Because of the narrowing of the coronary arteries. The treatment has been, and virtually always will be, for the period of time that I can be around, something called nitroglycerin. Grandma went into the hospital emergency room with pain in her chest, and they put nitroglycerin tablets under her tongue. 10 minutes later, Grandma's pain was virtually gone. Nitroglycerin breaks down into something called nitric oxide. Ever heard of it? What does it do? It dilates blood vessels. More oxygen goes to the heart muscles, and the pain experienced with the rubber band, if you will, around the coronary arteries was cutting off the oxygen to her heart muscles. That pain goes away. All right, there's a lot of ways to give nitroglycerin. Under the tongue with a little capsule, or several ways that are listed on this slide. I want you to look closely at the fourth one down, topical creams and ointments. Topical creams and ointments that contain nitric oxide can do wonderful things, right? We've heard about the skincare products. Here's a study that I think is in our scientific package of 45 papers, showing a randomized trial of nitrate cream for athlete's foot, something as simple as athlete's foot. So, you've got products that go on the face, but there are other ways to deliver nitrates to help other problems, such as a fungal infection in the toes. How many women wear open-toed shoes? What are those things that they wear in the summertime? Right. You want your toes to look nice. Take some of the serum, take some of the cleanser, take some of the day and night cream, rub it on your toes, see how pretty your toes look. This is what happens. This slide, I want you to take a picture of, excuse me, or write down, because this is the simple way to explain what our nitrate-containing products do. If you put something in your mouth containing something that has nitrates in it, it goes to the stomach. In the stomach, the acid in the stomach converts that nitrate into nitric oxide. The nitric oxide is a gas, excuse me, so it diffuses into the, excuse me, into the bloodstream and is picked up by hemoglobin inside the red blood cells that are coursing around the stomach. And therefore, that blood carrying nitric oxide is carried throughout the body to all cells. Nose, toes, earlobes, muscles. That's a joke. Muscles. All the vessels that are exposed to this hemoglobin carrying nitric oxide should dilate, allowing more oxygen to come to those tissues through which the blood is circulating. But also in that blood are vitamins, hormones, antioxidants, minerals, vitamins either water-soluble as we have in sunrise, or lipid-soluble as we have in sunset. Those will all go not only to the skin, but to the nose, the toes, and the muscles, including the cells that produce something called collagen. Collagen is the foundation which is broken down into my skin and face at my age over time. Hey, I'm missing a slide. I'm missing 2 slides, actually. Can somebody take me back 1 slide, please? Must be my fault. I told you it was tough getting up early in the morning. Seriously. There should be another slide showing that nitrates and nitric oxide help repair collagen. Okay? So believe me, collagen repair will actually occur. That means the muscles in your skin will actually improve. Your skin will become fuller. When you put on the breast products, not only will your skin glow, but it will look like a baby's fanny. Now, I have 1 minute left, but I'm actually not going to use it. I'm going to go backstage and speak to my audiovisual people. And I should have bought them a beer yesterday, but I didn't, and this is why. I want you guys that are guests to understand that this company is a family. And the science that we bring you is solid, irrefutable, and when you have questions, bring them to management, bring them to corporate. They will come down through the pipeline to us, and we will try to help you in developing your business. We don't treat diseases. We keep people healthy. Stay healthy.
Ladies and gentlemen, Dr. Thomas Burke. You know, the first time I heard Dr. Burke talk about nitric oxide and the effects it has on your body was the day I decided that me and my family were going to take the nitro products for the rest of our lives. The benefits are that big. So we were so excited. Thank you so much. We've got to get going here. We've got 2 more amazing speakers. This next speaker is a graduate of Yale College and Johns Hopkins University School of Medicine. In 1994, she became the first clinical director for the National Human Genome Research Institute at the National Institute of Health. Dr. Francomano is recognized internationally for her contributions to the field in hereditary disorders of connective tissue. She has authored more than 110 articles in peer-reviewed literature and 33 books and reviews. In addition to her professional role in genetics, She's also extremely passionate about the role of nutrition in bettering your life and becoming more health and wellness. She's been a member of the Scientific Advisory Board since 2011. Ladies and gentlemen, please help welcome to the stage Dr. CLAIR FRANCOMANO.
Wasn't yesterday just amazing? I think the skincare products are so fabulous, and I'm so delighted to have Dr. Haley on board with us and to have all the science behind the skincare products laid out for us so wonderfully. The company has just done an amazing job with that. Wouldn't you agree? So, what Dr. Burke and Dr. Kutab and I have been asked to do today is to talk about the core nutritional products and how they synergize with the skincare products to optimize skin health. And my job today is to talk about Kyani Sunset and your skin. So, as I mentioned yesterday during the Q&A, I was just astounded when I started looking at the scientific literature about what does omega-3 fatty acids, what do omega-3 fatty acids have to do with our skin? How do they help? And there is so much literature out there, I mean hundreds and hundreds of papers, supporting the fact that omega-3s optimize skin health in many different ways. Just to back up for a minute, we know that Kyani Sunset has our lipid-soluble nutrients for optimal health, the omega-3 fatty acids, vitamin E, tocotrienols, and tocopherol, beta-carotene, which is a precursor for vitamin A, and vitamin D. So all of these nutrients have very important impact on our skin health. But I'm going to start off and spend most of my time talking about the omega-3 fatty acids. Now there are three major benefits that the omega-3 fatty acids have for optimizing our skin. Number one, they protect our skin from sun damage. Number two, they fight wrinkles and protect against the effects of aging. And number three, they help us to maintain optimal hydration. And I'm going to give you some data about each of these things and talk about how the omega-3s actually accomplish these benefits. So in terms of protection from sun damage, the omega-3s protect the skin against sun-induced inflammation. They control how the skin responds to UV rays, and they mitigate the damage that ultraviolet rays can do to our skin. They also support the cell membranes, protecting the whole cell against free radical damage. Now you remember that the cell has a lipid bilayer that surrounds it. It's the cell membrane. And those lipids are absolutely key to protecting the cell and maintaining the cell integrity. So supporting the cell membrane is really crucial to protecting cell health. So in terms of protecting the skin from sun damage, this was a study that was done where adults consumed 3.5-ounce servings of omega-3 rich fish every 5 days. So not daily, not 3 3 times a day, just basically once a week. And in those adults who consumed the 3.5-ounce servings of omega-3 fish, they had fewer sun-induced keratosis lesions. And these are lesions that develop in people who have sustained extensive sun damage over many years. So the consumption of just a modest amount of omega-3 rich fish protected against the development of these keratoses. There was another trial. So the 20 healthy subjects ingested either placebo or fish oil capsules for 4 weeks. And in these subjects, there was a significant reduction in UV-induced erythema, or redness of the skin, in the subjects who consumed the fish oil. Another study. There were 10 healthy volunteers. This is a relatively small study. They took 5 grams of fish oil twice a day for 6 months. And then they actually allowed themselves to be subjected to a skin biopsy, and the skin was examined for the content of omega-3 fatty acids. So those volunteers who took the fish oil had a way increased amount of omega-3 skin content. And they also had a progressively increased MED during that supplementation period. Now, what you may ask is an MED. That stands for minimal effective dose. So it's the amount of sun exposure that was needed to create a sunburn. So in this case, when you increase the MED, you increase the amount of sun to which a person has to be exposed before they develop a sunburn. It's a measure of protection from the sun. So these people could be out in the sun for longer without developing a sunburn, and once the supplementation was decreased or stopped, the MED value returned to baseline. Here's another study. This one looked at the effect of purified EPA, which is one of the omega-3 fatty acids, on the UV response. And this was a slightly larger study. 42 healthy adults took 4 grams a day of purified EPA for 3 months. And this led to an 8-fold increase in EPA in the skin. And it increased the MED and reduced the measure of P53. Now, P53 is a marker of DNA damage, which is induced by ultraviolet light. And this was compared to those consuming oleic acid, which was the control population. Okay, so let's talk a little bit about what happens to our skin when we're exposed to the sun. The ultraviolet light causes an inflammatory skin response. It liberates a molecule called arachidonic acid from the cell membranes. And arachidonic acid is a member of the class of molecules that's called prostaglandins. And these are very, very inflammatory molecules. So if there is more EPA, or omega-3 fatty acid, in the membrane, it is also released by the UV exposure. And then less of those inflammatory prostaglandins are liberated. So you have less inflammation as a result of the ultraviolet light. Another thing that happens when you're exposed to ultraviolet light is that the immune response in the skin is diminished. So omega-3 fatty acids attenuate this diminishing of the immune response, and they cause less of those powerful prostaglandins to be made. So omega-3s have two major effects. They reduce inflammation and they reduce the immune deficiency that's caused by ultraviolet light, two major protective benefits. All right, now what about maintaining optimal hydration? So the essential fatty acids basically help keep the skin moisturized from the inside out. As I mentioned, the omega-3s are absolutely essential to maintaining the integrity of the cell membranes, and therefore they support that barrier function of the skin. And they're essential to keeping the moisture in and those irritants that are all around us out. If the skin's barrier function does not perform well, the skin becomes rough, it becomes dry, it becomes prone to irritation. It's more likely to actually break and not be able to maintain the barrier function at all then. So here's another study that looked at flaxseed, which is another source of omega-3 fatty acids. This study showed that supplementation with flaxseed diminished skin sensitivity and improved skin barrier function and condition. The study looked at half a teaspoon a day, and it increased skin hydration by 39%. That's quite a lot after just 12 weeks. And the subjects reported skin significantly was less rough and less sensitive. Now, we all know that the aging effects on skin are really quite considerable. And, you know, we often can judge about how old a person is based on how their skin looks, unless they've been using our Kyani skincare system. So, aging actually has effects both extrinsic and intrinsically. There are extrinsic effects that accumulate over time from things like sun damage, smoking, pollution, all those things in the air and around us that cause free radical damage and ultraviolet damage. The intrinsic effects are effects of our chronological clock. You know, there are functions in the body that actually change over time. It's a chronological thing that happens as we get older. So when we look at modification of DNA, something we call epigenetics, we see that that modification really changes over time. And there's something called the epigenetic clock. If you look at a person's DNA at any given point in time, you can predict how old they are based on the epigenome. So that's one of the scientific methods that we can use to look at chronological aging. And then there are also genetic effects in the basic structure of our DNA that can promote the effects of aging or retard the effects of aging. But we know that increased omega-3 consumption actually is associated with a reduction in wrinkles and visible signs of aging. And also with reduced dry skin and less thinning of the skin with aging. Now you heard Dr. Burke talk about collagen and how important it is for skin integrity. So collagen can be damaged by inflammation, and what happens is when the skin is exposed to ultraviolet rays, a group of enzymes called the metalloproteinases are made. Oxidative stress causes these metalloproteinases to be made. And molecules of inflammation, like the prostaglandins that I mentioned earlier, also cause these metalloproteinases to be made. And so the metalloproteinases are these enzymes that go to work on the collagen. They degrade the collagen, and they diminish the integrity of the connective tissue that underlies the skin. So when people have looked, they find that the omega-3 fatty acids actually may prevent the production of those metalloproteinases and protect the collagen from damage. It's a good thing. Okay, so the omega-3 fatty acids influence both the intrinsic and the extrinsic factors in aging skin. Alrighty, now, we have limited time, so I'm not going to go through in the same kind of detail the benefits of the other ingredients of Sunset. But I will tell you that vitamin E also has tremendous benefits from skin, and there is very sound science that supports these statements. Vitamin E protects the skin from free radical damage. It supports healthy collagen, which can minimize the development of wrinkles, and it also plays a very important role in supporting optimal hydration. Similarly with vitamin A, the vitamin A protects against UV damage, it slows signs of aging, it supports the development of healthy skin cells, and supports the skin barrier function. Now remember, we don't have vitamin A in our Sunset preparation. We have the beta-carotene, which is converted to vitamin A in the body on an as-needed basis. So it's a really good, safe source of vitamin A in the Sunset. So, in summary, our Sunset ingredients have enormous benefits for optimizing skin health. Together, they provide protection against free radical damage, they support the skin barrier function, they protect against all the external insults that are bombarding us every day, and they minimize the loss of connective tissue resilience and the visible signs of aging in the skin. It's really a great thing. So, as Jason said, I've been a member of your scientific advisory board since 2011. My name is Dr. CLAIR FRANCOMANO, and I live Kyani.
And Dr. CLAIR FRANCOMANO. Can you guys start to see how all of this is starting to work together? The nutritionals are going to help us to live a healthier life. The skincare, the fluorescent system, this all works synergistically together. And we have the wealth of knowledge to show it. So you guys, we've got one last speaker, and I'm honored to bring him up at this time. He holds a degree in medicine, chiropractic, oriental medicine. In addition, a PhD in Ayurvedic medicine. He's a board-certified in pain management, forensic medicine, and naturopath, and holds a master's certificate in neurolinguistics programming, whatever that means. I just know it's a big deal. This guy is smart. In 1989, Dr. Q-Tap found the Ella Vital Medical Centers in Massachusetts, combining the best of Eastern and Western medicine into an integrated, holistic approach. Dr. Q-Tap's speaking engagements include the World Health Organization, Congress of Complementary Medicine, and lectures at numerous hospitals around the world, including the Royal Society of Medicine in England. Dr. Q-Tap's area of interest also includes nitric oxide. He has researched nitric oxide and its role and function in the body extensively. And his latest book, Nitric Oxide, The Molecule of Life, has been translated into several languages. He has formulated and created products that are known throughout the world. He's our head of the Scientific Advisory Board. He's been here since the beginning. He's been an integral role in helping us to formulate all of our products. Ladies and gentlemen, please help welcome to the stage, Dr. Abbas Q-Tap.
Good information from, I was learning a lot from the doctors back then. You know, all the doctors, Dr. Hill came in, Dr. Francomano came in, and excellent information, right? Okay. Let me go into the concept, how these products are internally, why they are important with the skincare. So let's